Bismillah Rahman Rahim. Assalamu alaikum. I am Professor Dr. Javed Iqbal FAROOQI, and you are watching my YouTube channel Health Education. We are discussing kidney stones. Today, we are having second session of our discussion. Renal stones, also known as kidney stones, are small, hard mineral deposits that form inside the kidneys. What are the types of kidney stones? There are at least 5 types of kidney stones. First, calcium stones, which are the most common ones. Then uric acid stones. Third is the cystine stones. Fourth is the steroid stones, which are associated with infections. And fifth is the oxalate stones. So 5 types of stones: calcium, uric acid, cystine, steroid, and oxalate. What are the causes and risk factors for someone having kidney stone? These include, first, dehydration. Those who take less amount of water, drink less amount of water, they are prone to develop kidney stones. Then diet. If someone is using high sodium, high sugar, high oxalate diet, he or she is prone to have the kidney stones. Then family history. The kidney stone disease runs in the families. Obesity is another risk factor for kidney stone. Certain medical conditions like gout or the nephrolithiasis. Then sixth is the medications. At times, diuretics and calcium supplements, they can cause kidney stones. And geographical factors like hot climate, high altitudes, they are the risk factors for someone to have kidney stone. What are the symptoms? What these patients complain if someone has got a kidney stone? What can be the symptoms? These include severe pain, and the pain is in the flank, back, or in the abdomen. Then the person feels nauseated and vomits. There's frequent urination, goes to washroom again and again. The urine may contain blood, and he or she may be having burning sensation while urinating, and the patient may have fever or chills when infection is there. How the diagnosis is made? How it is found that someone has got renal stone? Of course, medical history, and then physical examination by the doctor, and then some imaging tests like ultrasound, X-ray, or CT scan, or KUB-CT scan. Then urine tests, urine cultures, urine analysis, blood tests like electrolytes and kidney functions. All these are the different investigations which your doctor will do for you to find out whether you have got stones or not, and if you have got stones, what are the types of the stone or what complications the stone has caused. What about the treatment? One is conservative management of renal stones. It means hydration, ensure the good hydration, pain managements with drugs, and of course, dietary changes. Then becomes the surgical options, and these include the extracorporeal shock wave lithotripsy, ESWL, then the percutaneous nephrolithotomy. The stones is removed surgically, the ureteroscopic lithotripsy, and the laparoscopic surgery. So different sorts of surgeries can be done to treat those stones. How we can prevent the stones formation? We should drink plenty of water. We should limit sodium and sugar drinks. We should eat a balanced diet. We should limit oxalates, rich foods, and of course, the regular exercise helps prevention kidney stones. When the stones are there, what can be the complications? These include kidney damage, infections, the urine blockage, urine flow blockage, that's the hydronephrosis, and chronic kidney disease, and at times the stones recurrent stones, or they appear again and again. Kidney stones can happen to anyone. But the good news is they are largely preventable. I have seen firsthand how small changes can make a big difference. Have you or someone you know have ever had kidney stones? Share your experience in the comments below. Let's spread awareness and help others avoid this painful condition. Let's share, like, and follow for more health insights. See you in the next vlog on another topic. Till then, take care. Khuda Hafiz.